Good afternoon, 5 minutes past 12 on Your Women Radio, WFM 91.7, and you're welcome on The Big Question. The Big Question is a program where we discuss and prefer solutions to issues affecting us as a nation and as citizens. The Big Question is brought to you Mondays, Wednesdays, and Fridays at 5 minutes past 12. Do well to join the conversation by joining the phone line. You can call in live 07000 917 917, or you can send us a text or a WhatsApp message on 0703 17 56537. The toll-free number is 0800 1235 917. My name is Esther Alaribi. And today on The Big Question, we're having a very important conversation. The big question today is discussing how KCCF is tackling childhood cancer in Kano. Now, Kano State, the second most populous state in Nigeria, faces significant healthcare challenges that threatens the well-being of its citizens. Limited resources, inadequate infrastructure, and a shortage of medical professionals have left many residents without access to quality healthcare. And also, childhood cancer is a growing concern in Kano, with many children being diagnosed every year, which is why today we're having to examine how childhood cancer is being tackled through the lens of the Kano Childhood Cancer Foundation. The report we're looking at today, a solutions journalism report put together by Mariya Shuaibu Suleiman, produced by Women Radio 91.7 in partnership with Nigeria Health Watch through the Solutions Journalism Network, highlights the effort of the Kano Childhood Cancer Foundation in tackling childhood cancer. So you're going to be listening to this report. I'll be back on.
Childhood cancer remains one of the most challenging health issues globally, affecting millions of young lives each year. Nigeria stands at the forefront of a harrowing battle against childhood cancer, with Kano emerging as a poignant focal point in this nationwide struggle. The World Health Organization, WHO, paints a sobering picture, estimating that Nigeria grapples with approximately 30,000 fresh cases of childhood cancer annually, disproportionately burdening low and middle-income regions like Kano. In Kano, the Nigeria Population Commission reported capturing and registering 1,109,515 births in the last 11 months across 844 local government areas. Recent revelations shine a harsh light on Kano's plight. The Aminu Kano Teaching Hospital, AKTH, witnessed an alarming surge in childhood cancer diagnosis. According to Dr. Suleiman Ali, a medical doctor at the AKTH, the hospital admits a significant number of children daily, ranging from 4 to 5 and sometimes more, due to the severity of cases. Despite concerted efforts, children in Kano, especially those aged 0 to 4 years, face daunting odds, with many succumbing to the disease during treatments. In 2023, Abdullahi Sarki Muhammad was deeply moved by the suffering of children diagnosed with cancer and the financial burdens placed on their families. As a way of giving back to the society, he established the Kano Childhood Cancer Foundation, KCCF, alongside his friends who had the same interests at heart.
It really was, it's actually in supporting the vulnerable children that are suffering from cancer. Vision is providing care and financial support and counseling to the families of, and of course, the children that are suffering from cancer.
Hadiza Musa Kazore, whose daughter Khadija battled with eye cancer, shared how the foundation's assistance was crucial.
I was scared my daughter Khadija was diagnosed with eye cancer. I thought I was going to lose her because we couldn't afford the treatment she needed. But fortunately for us, the foundation stepped in and paid for her treatment, medicine, and food. I am happy she is okay now and slowly getting back to her normal life, all thanks to KCCF.
Kazore's family, residing below the poverty line, struggles daily to provide even basic necessities. Before the intervention of KCCF for Khadija's eye cancer treatments, they often face uncertainties about affording food, let alone medical care for cancer. Professor Umar Shehu, the chairman of the Pediatric Tumor Board at AKTH and a co-founder of the KCCF, said over 80% of these families were very poor and struggled to cover the cost of treatment, which only exacerbated their suffering.
Seeing what my patients are going through, paying out of pocket is a huge burden, a lot of financial toxicity on the parents. In fact, more than 80% of my patients, parents are very poor, cannot afford to pay out of pocket for treatment.
According to the KCCF founder, the Board of Trustees consists of 5 people who oversee the foundation's operations, including cost for drugs, treatments, laboratory tests, surgery, and other essential needs such as food. He also noted that the foundation's source of funding is through donations by members of the board and friends.
It actually comes from us as friends, other well-wishers that cut across religion and tribe, and cut across the country, basically. A number of people that were colleagues in the industry, that are friends, have contributed a lot to the foundation. Today, we have a lot of funds in our account, and to go further, and I think we have about 24 patients that are under our care. Like I said, we have 24 patients in our books. Even as at this moment, as we're speaking, we're making a payment of about 700,000 naira to take care of chemotherapy and some few medication to some of our patients going forward. We work hand in hand with the tumor board of Kano Childhood Hospital. So it is the tumor board committee of the hospital that advises and recommend those patients that need financial support.
One of the beneficiaries, an 11-year-old cancer survivor, Aisha Aminu, who survived blood cancer, could not hold her joy as she got back to her feet.
I'm so happy with the treatment I got here, and thank you so much.
Her mother, Sadia Sani Aminu, tearfully expressed gratitude for the foundation's support, which enabled Aisha to receive life-saving treatment.
Without KCCF, we wouldn't have been able to afford our treatment. Seeing Aisha happy and healthy again is a miracle.
The foundation's assistance not only restored Aisha's health, but also renewed hope in their family. At the moment, the foundation only supports cancer patients below the age of 14 years. Also, Dr. Muatasim Ibrahim, one of the members of the KCCF Board of Trustees and a consulting pediatrician at the AKTH, highlighted the importance of the awareness campaigns carried out by KCCF. According to him, some people do not know what cancer is about. They may believe it's not a hospital problem and attribute it to superstitions like witchcraft.
Okay, the essence is to bring awareness of cancer to the society at large, the community, so that people are aware that we do have cancer, number one. Number two, that cancer, if detected early, is curable.
Beyond medical treatments, KCCF also provides essential supplies such as food to the children undergoing treatment.
To support the patient, feeding, to reduce the cancer burden, and then to alleviate anxiety, reduce some of this financial toxicity from the parent, to improve the quality of life, no matter how small.
Dr. Suleiman Ali, a medical doctor specializing in pediatric oncology at the AKTH, highlighted the treatment processes for childhood cancers, protocols involved, and the common cancers they treated at the hospital.
We have the commonest ones now we see is the cancer of the eye, which is what we call it neuroblastoma, followed by out of the blood, which is we call leukemia. So all sorts of childhood cancers, all childhood cancers are being received with us here in the teaching hospital, being that we have a center. Okay? So any childhood cancer, of course, you know that treatment of cancer is never an emergency. This, we must understand this. Why do I say it's never an emergency is that, number one, the child that you are treating nutritionally has to be okay. Meaning that if the child you are treating that comes with cancer, naturally cancer tells children towards what? Malnutrition. So you have to optimize the children first to be nutritionally okay before you can also go, because these cancer drugs are also very terrible drugs that has a lot of, on their own, has a lot of side effects. So after that, when I've optimized them, of course, you make preparation before you give cancer so that it will not create all those side effects that we know, because it can cause so many problems in this system. It can cause kidney failure most of the time. So we have to prepare them before the drugs.
Discussing the role of KCCF in early cancer detection and support, Dr. Ali explained that the KCCF plays a crucial role in public enlightenment and financial support for treatment, which is otherwise largely an out-of-pocket expense for families.
Like Prof have said, the tumor board comes in, we review and see what aspect can they support, because they don't have much money to themselves. What they can only do is to support. What they can do is to support. And that support is not even, it's just an aspect of what they can support. In the sense that, is it the aspect of drugs or what? So those are the areas that the pediatric tumor board, which is we the clinician and we the technocrat, now get to see. There's okay, then we recommend that, okay, please, this is the area we want people to come in.
Despite its successes, KCCF faces several challenges, including limited funding and the need for more specialized medical equipment. According to KCCF's Professor Shehu, the foundation is continuously seeking partnerships and donations to sustain and expand its programs as it aims to expand its reach and provide support to all children diagnosed with cancer in Kano.
The long-term aim is not just support, it's to make cancer treatment free for all children in Kano State. And like the name implies, Kano Childhood Cancer Foundation is not restricted to AKTH only.
He highlighted that the foundation faces significant challenges, both internally and externally. This includes late presentation of cases due to misconceptions about cancer from the community. Professor Shehu emphasizes the need for early detection and the importance of changing community perceptions about cancer. He added that KCCF plans to scale up its efforts by organizing a fundraising dinner in August 2024 aimed at garnering more community support. He added that the foundation seeks to enhance its infrastructure and training facilities to provide better care for children with cancer. Also, the KCCF founder highlighted they are working towards establishing a well-equipped cancer center to treat all cancer ailments free of charge. This report was produced by Mariya Shuaibu Suleiman from Women Radio, supported by Nigeria Health Watch.
You just listened to the report by Mariya Shuaibu Suleiman on how Kano Childhood Cancer Foundation is tackling childhood cancer in Kano. Now joining me on the program is Mariya Shuaibu Suleiman, the reporter of this article. Good afternoon, Mariya. How are you doing today?
Yeah, good afternoon. It's a pleasure to be here today.
Thank you very much for joining us, Mariya, and well done on this beautiful work you've put together.
Thank you.
All right. You on the other side, you can be a part of this conversation, letting us know what you think that we ought to be saying at this point in time, talking about the need to bridge the gap in treating children with cancer in Kano State. The phone lines are open, 07000 917 917. For women, you can call the toll-free number on 0800 1235 917. And you can also send us a WhatsApp message on 070 317 56537 to be a part of the conversation. So, Mariya, for you, what are some insights into the world of childhood cancer and healthcare delivery in Nigeria that you found out while working on this story? Mariya, are you there?
Hello, yes, I'm with you. Sorry, can you take it again?
Yes. So I was asking, what are some insights into childhood cancer, going by your findings in putting the story together, and healthcare delivery in Nigeria that you've been able to uncover while working on this story?
Okay, thank you very much for that question. During my data gathering and interviews, I was able to find out that there's so many types of cancers now that children are battling with, especially the new one, which is the eye cancer, which is so rampant, especially in Kano here. And it's actually something deadly that so many parents are struggling to pay for treatment, which is very, very expensive and is beyond them. So this blood eyes cancer is actually something that most parents cannot afford the treatment, which is why the foundation came in to support these victims. And they're actually doing great. Some of these children are actually, are getting the right treatment. And one of them is Khadija, who is now, she's better. She's back to her feet.
All right. Thank you very much, Mariya. The phone lines are open 07000 917 917 for you to call in and contribute to the conversation today as we get to look at this report on how Kano Childhood Cancer Foundation is supporting cancer survivors and tackling childhood cancer in Kano. The phone lines are open 07000 917 917. You can send us a WhatsApp message on 0703 17 565 37. And for women, you can call the toll-free number on 0800 1235 917. In case you're just joining us, it is 22 minutes past 12 on Your Women Radio 91.7. My name is Esther Alaribi, and today on The Big Question, we're looking at how KCCF is tackling childhood cancer in Kano. And in case you haven't seen this report, the report How Kano Childhood Cancer Foundation is supporting cancer survivors, tackling childhood cancer in Kano, you can go on, log on our website, www.wfm917.com, search the headline, How Kano Childhood Cancer Foundation is supporting cancer survivors, tackling childhood cancer in Kano, and you definitely find this report, and you can go ahead and read up some more on the report being put together by Mariya. Mariya, the solution or this gap being bridged by KCCF, what is being provided, it has really helped the parent by taking off some of the bills from them. But what do you think that we need to do as like a more sustainable method for helping the children with cancer in Kano State? Because we need long-term solutions.
Okay, yeah, that's a very good question. I think, this is actually something big and it's beyond the organization, beyond the foundation itself. It's something that really needs community support, it needs government support. It needs everybody to come together and support these children, especially when we're considering the fact that out of 5 children that are born daily, 1 to 2 of them are born with cancers now. That was what we found during the investigation. So I think we all need to come together, the community, the government, and everyone to support these children because it needs to be sustained. It needs to be sustained, and it's not just something that we can just say, okay, we support them and then it ends here. No, what happened to the children that will be born tomorrow, and then we're still battling with these cases, and then the ones that we have, we are not even treating them. So it's something that we actually have to come together, and government needs to really, really be involved in this kind of situation.
All right. Thank you very much, Mariya, really. So what would be your call to action words to stakeholders in this report to ensure that we get to save the lives of children with cancer in Kano State? KCCF is just one foundation preferring solutions in the way that it can. And from the report as well, they have challenges. There are challenges that they also still need support to be able to surmount and still keep giving the support that it can to residents in Kano State, especially for children with cancer. So what do you think we need to be saying to the stakeholders at this point?
Okay, my call to everyone is, especially stakeholders now, is to support this foundation, support them in this movement to see that we help these children, we save them from dying, because at the long run, most of them, they died, especially those that are not aware receiving cancer. So we actually need to come together, and then government needs to do it her own own part, because the Aminu Kano Teaching Hospital is the only hospital in Kano that has the cancer center. And so this foundation is in partnership with this hospital.
Mariya, let me pause your thoughts for a bit. Let's hear from this caller. I'll get back to you. Hello, good afternoon. Hello, good afternoon. Yes, good afternoon. What's your name? Where are you calling us from?
My name is Dr. Shuaibu. I'm calling.
Hello, can you hear me?
Yeah, can you hear me?
Yes, please be more audible. What's your name? Where are you calling us from?
Yes, my name is Shuaibu. I'm calling from Kano.
Okay, thank you very much for calling.
Thank you.
Yes, please go ahead with your comment.
Yeah, so my comment is I just want to thank Ms. Mariya for this wonderful job, and just to add up to the discussion, just to contribute, I just want to say that one of the major issues really we are facing is really the late presentation. Among the team that cares for children with cancer in Kano, and I'm the chairman of the Kano Childhood Tumor Board, pediatric tumor board in Kano, and also so we work hand in hand with KCCF. So just want to highlight one of the major challenges, the late presentation. So what we need to do, for example, in the case of eye cancer, where these children are coming with advanced disease that has already spread to involve other parts of the body. And at that time, there's a little somebody can do to salvage these poor kids. So I think our role here is more of enlightenment, just like what we are doing now to bring this to the community. So we need to sensitize the community about the early signs of cancer, particularly this eye cancer that is the most common, so that at least once you catch them early, is a curable disease. It's not only curable, you can actually salvage the child's vision. But the way they are coming, there's nothing anybody can do than to remove the eye, because the eye has already, there's nothing you can do. So if they come early, you can be able to treat the disease as well as salvage the child's vision.
All right.
But we need to put some infrastructure in place. That's why we need the government to come in here to provide all the necessary facilities for early treatment, early detection, to be able to diagnose the disease correctly. And then, of course, the national health insurance that is currently in place should include some of these treatments. Even though I know the National Health Insurance Agency now has included treatment for cancer, but it should be more elaborate to be able to support and pay for this care 100%. Unfortunately, the National Health Insurance now covers only people in the public sector, and leaving the poor part of the community at the receiving end, coupled with the current financial reality.
All right. Thank you very much, for your comment.
Thank you.
Thank you very much. Thank you. Yes, and he's able to contribute to this conversation. The phone lines are still open, 07000 917 917 for you to contribute to this conversation as we get to look at how KCCF is tackling childhood cancer in Kano. And this report was put together by Mariya Shuaibu Suleiman, who is my guest today. And the report was produced by Women Radio 91.7 in partnership with Nigeria Health Watch through the Solutions Journalism Network. Hello, good afternoon.
Good afternoon, Women Radio.
Good afternoon. What's your name? Where are you calling us from?
My name is Lillian. I'm calling from Oba.
Good morning, Lillian.
Okay. So, well done, Mariya, on your report. I want to know, based on this report and what we saw in Kano, are the parents having more knowledge about the cancer that's affecting children, and what are they doing about it? Is there better education for them? That's just what I want to know.
All right. Thank you very much, Lillian, for your call. The phone lines are still open, 07000 917 917, and you can also send us a WhatsApp message on 070 56537. Mariya, you've got a question from Lillian, and she's asking, based off of your report and what KCCF is doing in Kano, do you think that the parent are better equipped with information on how to handle the children, early detection, and knowing where to go to?
Okay, thank you very much, Lillian, for that question. Like Professor Shehu mentioned, one of the challenges is most people are not even aware of cancers, and some that know about cancer, they believe is a spiritual something. So one of the role that KCCF is playing actually is to enlighten people. They organize workshops and to enlighten people about cancer and how they can go about it. So the thing is, most people are not really aware, considering the fact that Kano is a very large state. So they KCCF alone cannot cover the whole Kano, but they're actually doing their best. And some people know, but most people don't. Thank you.
All right. Thank you very much, Mariya, for your response to Lillian. I hope that Lillian has gotten the answer to her question. The phone lines are open, 07000 917 917. For women, you can call the toll-free number on 0800 1235 917. To send us a WhatsApp message, you can send it via 070 56537. Once again, if you haven't seen the report, you can go on to our website at www.wfm917.com and you'll find the report on how KCCF is tackling childhood cancer in Kano. And so far, so good. We'll be talking to our guest, Mariya Shuaibu Suleiman, who reported, who put together this report. And yes, we've heard from the different stakeholders in this particular report. And Mariya was just going to wrap up her comment on call to action for stakeholders, government generally at different levels. Mariya.
Thank you for giving me this opportunity again. I would like to call on the government to support this foundation, not only the government, but also the community. I mean, at the community level, they're actually trying to support this foundation with funding, but we still need government to come in to this children rescue.
Okay. All right. Thank you very much, Mariya. We've got a call here. Hello. Good afternoon. Hello, good afternoon.
Hello, good afternoon, Esther.
Yes, good afternoon. What's your name? Where are you calling us from?
My name is Lydie. I'm calling from Arepo.
Good afternoon, Lydie.
All right, good afternoon. I must say a really big well done to Mariya for putting up this report. And I also would like to ask her, is there any way, these hospitals have been getting support from the government, or are they just doing all of these things on their own?
Okay. All right, Lydie. Thank you very much for your question. Mariya, you have a question from Lydie. So she's asking, is KCCF getting any sort of support at all from the government, or they're just having to navigate through this on their own?
Okay, thank you, Lydie. The foundation is not supported by the government at all. It's some group of people that came together, to fund the foundation and support these children. So government do not support this foundation at the moment. That's why we are calling them in to help and play their own part.
All right. Thank you very much, Mariya. Thank you for your report and thank you for joining us in this conversation this afternoon.
Thank you so much, Esther.
All right. Thank you. Do have a wonderful afternoon.
Yeah, you too.
Okay. So there we have it. That's the story of KCCF's fight against childhood cancer in Kano State. Through the lens of solution journalism, Mariya has been able to highlight the challenges, the positive impact of KCCF's effort and the difference that they are making in the lives of these young patients. But the fight is far from being over. Childhood cancer is a complex issue that requires a comprehensive response from the government, health ministries and agencies. So yes, the fight is not over, so there is more that we need to do to be able to bridge this gap, reach out to the survivors, patients, and also create more awareness on this. Special thanks to Mariya for an excellent report, and well done to KCCF for providing a solution. So again, if you haven't seen the full report, you can go catch up on it at www.wfm917.com with the headline, How Kano Childhood Cancer Foundation is Supporting Cancer Survivors. This report was produced by Women Radio 91.7 in partnership with Nigeria Health Watch through the Solutions Journalism Network. Thank you very much to you, our caller. Thank you, Sheo, Laide, and Lillian. Thank you very much for being a part of the Big Question today, as the Big Question is where we discuss and profile solutions to issues affecting us as a nation and as citizens. Thanks to the producer, Miracle Philip, for this production this afternoon on the radio, and big thanks to the executive producer, Tom Okewale Shunaya. The Big Question, again, as we know, is where we discuss and profile solutions to issues affecting us as a nation and as citizens. And do not forget that conversations like this do not end here. We must continue to raise awareness on these issues and continue to speak about the solution, profiling solutions, because more importantly, we need to see more solutions. And remember, the Big Question will be back on Monday, Wednesdays, and Fridays at 5 minutes past 12. My name is Esther Alaribi.
WFM 91.7.